Hi everyone, Dr. Marian Owen, Whole Family Medicine, and I was heading out my back door to do some work in my garden with my dog over there. Where is he? Over there. Can't do the backwards thing. That's Henry. And I made myself stop because I owe you guys some thoughts on COVID boosters. So here it goes. I've got my notes. I got my old lady reading glasses, and I'm ready to rumble. So this is vaccine specific. If you got the Johnson & Johnson vaccine, your immunity was never as good, unfortunately, as those of us who got the mRNA vaccine. So people who got the Johnson & Johnson vaccine, no matter your age, no matter your risk factors, no matter anything, the recommendation is that you guys get a booster. It's recommended that you get a booster of the Johnson & Johnson vaccine, and that's where I'm a little not sure. There are some studies coming out of Europe that are showing that people who got Johnson & Johnson do better when they get a booster. I think the one I saw was with Pfizer. So I think the jury's still out, and if you don't mind waiting about a month, I think it will become clearer. Between now and a month from now, probably your only option is to get the Johnson & Johnson, and if you are in a high-risk category, I would suggest you go ahead and do that. It might just mean another booster down the line. But if you're in a lower risk category and you're not having a lot of exposures and you feel safe waiting, I would wait just a little bit longer. Keep doing all the things that you do to prevent getting COVID. Don't go to crowded places. If you are inside with other people, wear a mask. Don't go places where people aren't wearing masks. And just protect yourself generally. Continue to take care of yourself, and hopefully your immunity will keep you from getting real sick. But I would just wait another month and see if you don't become eligible for either the Pfizer or Moderna booster. And that's what I would do if I were you. Okay, Moderna. That immunity does also seem to be waning. The Moderna booster is a half a dose of what you got before, so the side effects don't seem to be quite as strong. And if you are in a high-risk category, so if you're over 65 or if you have a chronic illness, and I'm going to try to remember to put the link from the CDC of what defines those chronic illnesses below, but it is extensive. Here we go. It is. If you live or work in a high-risk setting, long-term care, taking care of sick people, prison, that populations where you can't control your own exposures, you should get a booster. If you have cancer, kidney disease, liver disease, lung disease, heart disease, dementia, diabetes, HIV, Downs, if you're immunocompromised, if you have obesity, sickle cell anemia, depression. So, you know, it's a pretty broad. I think almost anyone could figure out how to get themselves into one of those categories. So if you're inclined to do so, I think it is fine for you to go ahead and get your booster. And I say do it. I'm planning to do it. I got my flu shot Friday, Thursday, and I plan to wait a week or so and then go get my booster. Pfizer. So this includes our younger people. And this is where it gets a little, there's a few caveats. So broadly speaking, unless you are a man under 30, the following applies to you. Get your booster shot. If you are in any of those risk categories. It is not yet recommended that everyone do it. It's still like the same risk categories I just rattled off from Moderna, over 65 and all that other stuff. So if you're inclined to do it, do it. But I would say if you are in a low risk, under 30-year-old male category, I would say wait a month or so. There is, it's becoming clearer with some recent studies that came out of Israel because of their kind of compulsory military service. They've really been able to monitor what's been happening in this younger age group with the myocarditis, pericarditis side consequence especially after the second vaccine. And so since it's after the second vaccine, I worry that that means it will also be worse after the booster. So I just would like to give that some time to wash out and become more clear. So my son is in this category of people that I'm talking about, and I'm not going to have him get the booster yet. So that is because in that age group, get my readers back on, in that age group, although it was a 0.002% overall risk of the myocarditis, pericarditis, in that age group, the 16 to 29-year-old males, there were 10.7 cases per 10,000, which is much higher than that other percentage I just said. So that gives me hesitancy, especially to say, well, then get the third one. And since in that age group, unless you have some other chronic medical problems, in that age group, you are not at extremely high risk of COVID. And if you've already gotten your 2 vaccines, your risk of getting severe illness is even lower. Just playing all of those risks out in my brain, I say, let's wait and see. So even if you might have some exposures, I would say probably let's wait and see. If you're not sure, like, oh, you know, I am in fact undergoing cancer treatment, no, go get your booster. If you need to hear me say that to you personally, call me and I will. But if you're in a, like, could I figure out a way to finagle my way into a booster, don't do that if you're a male between 12 and 35. Oh, and back to Johnson & Johnson. I hope you're still watching. If you're a female under 50, I don't think you should get the Johnson & Johnson vaccine. Wait until they approve a different booster. Shoot. I should have said that earlier. But see, I'm in a hurry because I want to go garden. So I hope you guys are watching this just because I'm so charming. Anyway, that's it. So Moderna, Pfizer, over 65, high-risk category, or you just feel like you need to finagle yourself into a high-risk category, I think you can totally legitimately do that. Johnson & Johnson, guys, absolutely. Women under 50, wait until maybe we can get a different form of vaccine for you. And young, healthy people with Johnson & Johnson, you might want to wait too, just to see if you can get a different one, because I think we're going to find, it seems to be pointing to that we will find that you get better immunity if you get a different vaccine, even for your booster. So that is my, I'm sorry, a bit rambly, but summary of the vaccines. If after watching this you are not sure what category you fit into and you are one of our patients, you give us a call and we will try to navigate this for you individually. Between now and then, I hope all of you are outside enjoying this absolutely glorious day. Fall is here. It is cool in Georgia. It is wonderful. I'm going to go dig in the dirt now. Be well.